Welcome to the April 19th, 2022 Pharmacy Technician Summit. My name is Debbie Veal, Chairperson of the Licensing Committee. Before we convene, I would like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. This meeting is a hybrid meeting being conducted both in person and via WebEx. The meeting is also being webcast. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting who is remote should attend in person or via WebEx meeting. Information and instructions are posted on our website. So let me repeat that again. If you're webcasting and you'd like to participate, please connect via WebEx, and then we'll be able to have you, we'll be able to unmute you and have you participate. As I facilitate this meeting, I will announce when we are accepting public comment. I have advised the meeting moderator to allot 2 minutes to each individual providing comment. At appropriate times, we will begin by taking public comment at the agendized location, which is here in Sacramento at 1747 North Market Boulevard, and then we'll take public comment via WebEx. This approach is necessary to facilitate the meeting, and I appreciate everyone's understanding as we navigate this hybrid meeting format. Before we get started, I would like to ask the meeting moderator to provide general instructions on how to provide comments via WebEx.
Thank you. This is the moderator. For our public commenters on WebEx today, we will be utilizing the question and answer feature in WebEx, which you will hear me refer to as the Q&A. We will also be allowing the hand raise feature for those who are dialing in to the meeting. When public comment is called, I will open the Q&A feature, and you will hear me call for that with members of the public who wish to make a comment. I'm being requested to click on the Q&A icon on your screen, which will look like a question mark inside of a square. In the text box that appears, you can simply type the word comment and then click the send button. To utilize the hand raise feature for our call-in users, you can dial *3 to raise your hand and then *3 again to lower it. We will be displaying instructions on the screen when public comment is open. And after we have taken public comment from our Sacramento location, I will call on those individuals requesting to comment through WebEx. Each individual will have 2 minutes to make their comments, and I will provide a 10-second reminder when the allotted time is about to expire. At the conclusion of the 2 minutes, the individual's microphone will be muted, and I will move on to the next member of the public who has a comment. I would also like to remind, oh, sorry, you guys are all in person. That does not apply. With that, I'm finished. I'll turn the mic back over to the chair.
Thank you, moderator. Before I take roll call, I would like to extend my gratitude to all the stakeholders that have participated in the listening sessions or surveys released by the board. As we progress through the summit today, you will note that this information will play a significant role in both of the summit and our future discussions. I would like to take the roll call and establish a quorum. Members, as I call your name, please remember, well, everyone's here, but remember to turn on your mic, and then your name and whether you're a public or licensee, please. Cheryl, can I start with you?
Yes. Lavanza Cheryl Butler, licensee.
Jig Patel, licensee.
Jason Weiss, public member.
Sung Oh, licensee member.
Debbie Veal, licensee member. With a quorum being established, the committee will now entertain any public comment for items not on the agenda. To facilitate this portion of the meeting, as I previously announced, I will first provide members of the public that are present in this location at the agendized public meeting location to provide public comment. And then we will have individuals on WebEx will be able to provide comment. You are not required to identify yourself, but you may do so. And just as we accept public comment, I'd like to remind you that we cannot take action on those items today. except to decide whether to place an item on a future agenda. So we won't discuss them, answer questions, we'll just nod our head and decide if it will be a future agenda item. So, my fellow members, please, following the public comment for this agenda item, I will survey you each individually to determine if any of you would like to place the items that are brought up during public comment for a future agenda. Okay? Okay. So first off, for the folks here at, on Market Street, is there anybody who'd like, public comment for future agenda items? Don't all rush the mics at the same time. Okay, seeing none, moderator, will you see if there's anybody, on WebEx that would like to provide public comment for future agenda items?
This is the moderator. We've opened that Q&A panel. If you're joining us on WebEx and would like to make a comment, please click on that Q&A icon, type comment into the text box, and send that through to the host or panelists. And if you're a call-in user, you may use *3 to raise your hand. And I am not seeing any requests at this time.
Thank you, Ms. Moderator. So I guess there's nothing for us to discuss as a committee, and we'll move on. And before I move on, I do want to mention to both the individuals here in the room as well as on the webcast and WebEx, we did receive an additional article, expanded pharmacy technician roles, accepting verbal prescriptions and communicating prescription transfers this morning as the individual came into the room. Since it's not part of our meeting materials, we aren't able to share it, but after this meeting we will put it on the board website as just additional information about this topic. So we appreciate the individual providing this additional article. It looks very interesting. Okay, moving on to agenda item 3, approval of the January 19th committee minutes. Members, included in attachment 1 is the draft of our January 19th, 2022 minutes. Any questions or comments on the minutes? Okay, seeing none, I would entertain a motion for approval.
This is Song. I can make a motion to approve.
This is Cheryl, I second.
Thank you. Folks in the room, does anyone have any comments about the minutes from January 19th? Seeing none, moderator, will you please check on WebEx and see if anybody would like to make any, of the public would like to make a comment about the minutes from January 19th?
This is the moderator. Our Q&A panel is open. If you'd like to make a comment, please click on that Q&A icon, sending the word comment, or dial *3 to raise your hand if you're a calling user. Seeing no requests.
Okay. Okay, so agenda item 4, just one sec. Sorry. I'd like to call for the vote. Cheryl, how do you vote?
Yes.
Jing?
Yes.
Jason?
Yes.
Song?
Yes.
And I vote yes, so unanimous. Just one sec. Okay, agenda item 4, is presentation, discussion, and consideration of the national perspective on the role and responsibilities of pharmacy technicians. I'm pleased to let you know that Bill Cover, Associate Executive Director with the National Association of Boards of Pharmacy, commonly known as NABP, will provide a presentation on the national perspective of pharmacy technician roles and responsibilities. Bill, I think, is here remotely. Is that correct, Debbie? Okay, can we connect, Mr. Cover? Does the moderator have to connect him?
Yeah, we're loading it. 1 second.
Okay.
Mr. Cover, you have control of your microphone.
Good morning. Can you all hear and see me okay?
Yes, we can. Thank you.
Okay, excellent, excellent. Well, good morning. Thanks to Chairperson Zeal and the committee for allowing me to speak to you all on this extremely important topic around pharmacy technicians. Really, before I kind of talk through things more in my role, I have all the accreditation inspection programs, and as well as working with all of our member boards. And our member relations group does a lot to understand what is going on across the various states. And so hopefully this information can help your committee as you look towards, the role that the pharmacy technician and again, the important role that those individuals play within the, practice of pharmacy within or even outside of the pharmacy. So again, I'm just as asked as to kind of give some national perspective of what we're seeing, some of the different stakeholders that are having meetings relative to pharmacy technicians. So with that, see, do I have slide control on WebEx? Can I ask the host?
I don't know. Moderator, do you move the slides or does Mr. Cover?
Unfortunately, the way we have to share it, he will not be able to control those slides.
Okay. All right. That's fine. Thank you. As always, we want to reiterate to the public that NABP, or the National Association of Boards of Pharmacy, is the independent, international, and impartial association that assists its member boards in protecting the public health. Again, your board is one of our members, and that's part of our mission is to, again, assist you in various ways. As such, we are doing today. So thank you again for this opportunity. And with that, if you'd like to move to the next slide for me. So first of all, just to give just a kind of a current state, and this is more as far as how technicians are are regulated or, some of the requirements relative to licensure registration across the states. So again, the number of states that actually license technicians is at 15, and that's been consistent for a number of years. And on the flip side of that, around 35 states register pharmacy technicians. And in various, states, that means different things as far as the way in which they are, the application process, the requirements, in addition to some of the enforcement action that can be levied on these individuals. As far as the number of states that we have 24 that require technicians to obtain certification through various approved certification programs, and as well a number of states include a technician training program requirement. This again in many cases are programs that may be offered by a national organization, could be part of a job or type of organizational training program that has been brought to the board and approved. So there are varying ways in which this is played out across the states. And then there are about half the states or more that require a technician to take an examination, and primarily those are the examination administered either by PTCB or by NHA, National Healthcare Alliance, that their exam is called EXCPT. So again, I just wanted to provide some of the level set where the states are as far as technicians as relates to licensure and registration, some of those requirements. If you could move on to the next slide for me, please. I think that we all, witnessed over the past 2 years the impact that an unforeseen, public health emergency of huge magnitude, and pharmacy technicians, played a huge role in what occurred and in the response that all areas of pharmacy were able to provide, to all those that were in need of care, as well as the vaccination effort I'll talk a little bit more about later. But in many respects, the change and the pace of that change has really accelerated to many, in my opinion, at least 5 years, where many states it would have been a slower adoption of some of the things I'll talk about. But really, this pandemic, I think, has provided a means to demonstrate very unfortunate circumstance, but it has really demonstrated what pharmacy technicians can do in the public health and for the community that they serve. The PrEP Act obviously had a piece of it that authorized pharmacy technicians to administer COVID-19 vaccine. And up to this point in time, there was, around 5 states that allowed technicians to immunize in any way. So to go to every state having this authority really gave technicians a means to really show and demonstrate that what they can help and really balance all that was being put on our community, institutional, across all the different healthcare settings where pharmacy practice occurs. But again, we delivered, and especially on the community practice side, over 2/3 of the nation's vaccines, and technicians played a huge role in getting that done. As well, I think this really helped demonstrated a safety record for, the combined efforts of the pharmacist and the pharmacy technician and ensuring that that was the right, right dosage, right patient, everything that needs to be documented. The combination of the pharmacist and technician was very effective and delivering these immunizations that had occur across the entire country. And with that, again, I think this gives a great backdrop to the expansion of pharmacy technician roles that can enable. Again, we've spoke to this for a number of years of what allowing pharmacists to practice at their top of the license. And again, I think hopefully we have some recent evidence of what technicians can do to support pharmacists continue on their path to providing great community care and in any setting. With that, please move to this next slide, please. I want to talk just a moment about a work group that met last August, and really this was again one that came out of our annual meeting and from our larger membership to create a work group that focused on what things were waived, during this health emergency, either through executive orders within the states or through the PrEP Act. And so this group really, was charged in looking at, what things should potentially occur all the time, even outside of a public health emergency. In addition, what things might be allowed, if waived by the board, or are there things that if emergency is declared, they should just automatically be allowed to occur. And I think part of this being is so that it provided information and guidance to the states on what potentially could be put into regulation, or in maybe in the right caveats, so that we don't depend upon the executive branch to create executive orders and all that went through, creating those. I think we all saw that, the level and the length of executive orders that it took to accomplish all this, and perhaps this is a learning lesson that if we can put some of those into emergency declaration area or of regulation, then we might be able to avoid some of that and even speed the way in which those waivers could be applied. But coming out of that, I took some excerpts from the report, which I did provide to Ann, the report from this work group. But again, specifically towards technician, this group definitely supported the expansion of scope of practice for pharmacists as well as pharmacy technicians in all circumstances. And I think in the next bullet, it kind of talks to what are some of those things, and more specifically around administration of vaccinations by pharmacy technicians, as well as their involvement in the delivery of point of care testing. I think really a lot of the media and the attention has been brought to the vaccination effort, but the amount of COVID-19 testing that had took place across the nation within pharmacies, a lot of that was done by pharmacy technicians in the communities. So I want to, kind of reiterate that. But in addition, the pharmacists continue, the members agreed that, pharmacists looking at, what can they delegate, that providing the technicians training, skill, and experience, what things can those pharmacy technicians do that, again, can support their overall team mission of the pharmacist and technician to really give high-level care regardless of the setting that's delivered. So I think that again was really some of the strong statements coming out of that work group that was held last August. So that if I can move on to the next slide. One of the things that I wanted to bring attention to that we're starting to see in other settings, but it's been kind of a longstanding practice in many states of allowing this check tech in institutional settings, and so that I think over many years has shown really a high level of quality delivery of technicians, providing that type of overview. And in many cases, institutional settings have incorporated, barcode scanning technology in all of their fulfillment processes that aid those technicians in completing that. And another area that of I guess delegation by a pharmacist in a way to balance what their role is and keep some of that focus on clinical and patient care activities. But more recently, we've seen states moving in the direction of allowing this to expand outside institutional settings. Arizona, it's more recent, has a regulation in place that allows for what they call it the technology-assisted verification of product. Again, not limited to a specific practice setting, but again, an emphasis on that there's a technology-assisted. So there's a lot of detail in that regulation that you all can review that gives again some of those safety components that can help and make sure that that's delivered in a very safe manner. Idaho has a section which they allow for the verification of dispensing accuracy to be done by someone other than the pharmacist. So that does allow, again, the technician to complete that, and the regulations are fairly broad in how that might be done. I thought their inspection report also goes into looking at how that is completed and what are the safety components that are done in the case of a technician that would be dispensing or doing that dispensing accuracy check. State of Iowa also by statute has they call it technician product verification program. Again, this is not limited to specific practice setting. There are specific rules that also apply and does require like a presenting the information on the program and how it will be completed to the board for their review and approval. But Iowa was doing this, I know, as a pilot project for several years prior to this going into statute and rule, and found very good success from a safety and quality perspective in the pilots that they operated, that they were monitoring within that state. So I think that's very promising to look as we consider, again, what pharmacists are able to do, and balancing again their role with some areas that pharmacy technicians can provide the right environment and the right tools can very safely and accurately complete. If you could move to the next slide, please. Telepharmacy practice. I think this is one of the terms that I'm constantly, I hate to wordsmith or correct people, but telepharmacy, telemedicine, telehealth, they all in many cases get thrown together in a kind of a difficult to make sure on the audience is clear. But again, telepharmacy it's not a new practice type. It's been in many states, especially in the ones that have the geographics are quite large, the Dakotas, the Montanas, and some of those where really from a patient care access, they've been in existence for many, many years. But again, it's a pharmacist that is monitoring, supervising, and verifying basically the preparation of a prescription, and then as part of the delivery availability for a remote consultation of an individual at a different facility where only pharmacy technicians are in person. So again, we've seen a large expansion of states that are allowing this practice model. Again, we went from probably 5 or less 10 years ago to not nearly almost half the states have telepharmacy practice allowances. Some are more I would say broad in scope. Some have limits placed on geographics, distance from an existing pharmacy. So there are a lot of variabilities in what's allowed. The only one that's currently today in active legislation is a New York Assembly bill that's actually started in last year's Assembly and still active. But again, we've seen this type of practice really increase, and in some cases, really out of need because numbers of smaller communities losing their only pharmacy and access to that is really kind of in some cases driving this need to for them to be able to get pharmacy services due to long distances for them they potentially may have to travel, as well as many of the technology costs of when this was originally came have dramatically decreased and made it more affordable for pharmacies, especially independent pharmacies, to be able to do. And with that, a lot of these processes and technology, as I mentioned, have matured, and what has worked well and what are things to improve. So a lot of that's been really worked out, and I know there's a number of organizations out there today that are capable of providing these services for from the technology to the processes that are kind of a canned and ready to utilize type of approach. I guess the bottom line of this is a new area and opportunity for these highly skilled pharmacy technicians that are there in these communities to deliver these the prescriptions to those that need them in a different manner. So I will with that move to the next slide. As I discussed a little bit earlier relative to COVID-19 pandemic, I think the administration of vaccines is one that's really kind of a changing landscape, and I think that that was reinforced by that work group and that we held last summer at NEBP. But currently, there's 7 states that allow technicians, to administer vaccinations. Again, these are ones that are outside of COVID-19 vaccines, which are now still allowed under the PrEP Act. So this would be again allowing for other types of vaccinations to be delivered. There's still currently there's 2 bills, that have passed in this year's legislative season. That's Florida House Bill 1209, as well as New Hampshire House Bill 572. There are still bills in motion within the states of Alaska, Louisiana, and Virginia. So again, the number and just the pace of change and the acceptance of technicians be able to deliver vaccines outside of a public health emergency, I think it's dramatically increased. Just due again the kind of evidence that we've demonstrated that they are very capable, again, under the proper supervision and engagement and team approach with the pharmacist to make sure it's done accurately, safely, and the pharmacist is there in the event of some type of emergency type response that an individual might have to a vaccine. With that, I'll move to the next slide. One thing I wanted to bring as well, we provided this report to Anne as well that can be shared, but there was a recent summit that APHA held, and NEBP was part of this group. But it was APHA. It was a community pharmacy workplace summit, and they recently released the report that was from this meeting, and it was, as I mentioned here, it was a really large cross section of stakeholders, from association to it was organizations of pharmacy organizations, independent pharmacy owners, technicians, interns, students. So really from all the different cross section of those that are seeing, again, where are workplace conditions within community pharmacies today. And I bring this into this conversation because I think it does have relevance to pharmacy technicians and their important role. But I wanted to call out a few of the things from this report that were specific, to technicians. And some of that is to really, encourage, pharmacists to coach pharmacy technicians. And because, again, in many cases, they are the frontline individuals that are greeting and taking care of those patients, and ones that are not feeling well in many cases, and can sometimes be in need. They need encouragement to have that empathetic and positive interaction with those patients. But I think some of that comes from, again, valuing the pharmacy technician, and really that will then help them to treat patients in a better way as well. I think that some of this came actually from technician in attendance is calling themselves out and not just saying I'm just a tech, to really support the important role that they have, and that it's one of again, they're pharmacy technicians and what they provide, and really not looked at as just that adjunct help for the pharmacist, but a critical piece of how pharmacies today deliver care. Part of the recommendation was engage pharmacists and how can they be utilized, and empower technicians, again, to really be a critical part of what's delivered. And one of the roles is coming out in this report, saying that pharmacist to technician and the ratios are not one size fits all relative to practice settings and potentially how it's operated, and various pieces of automation and different things was part of that discussion. And also, again, really talk about pharmacy technicians and and how are they compensated and developed? I think that is a key piece of what we're talking about in this meeting, and what many organizations are looking at today is, as our, pharmacies are seeing shortages of pharmacists and pharmacy technicians, just like you see in other healthcare professions. I think again, some of what what I just talked about, the expansion of what they do, the proving the value and delivering that. I think that some of that's playing out today, and really as far as how they're supported and developed, not just as a part-time employee or one that you do that for several years and you move on to the next role. Is how can pharmacy technicians create this as a career path, and one that they stay within, and are proud and really see their role in the healthcare delivery. And I think that's a critical part of whether we're talking about technician scope or when we're talking about workplace conditions. Is and what we see today is looking for solutions and across all the different stakeholders to really find ways to support technicians, and advocate for their important roles, so that individuals will want to come in to this role, train and get to the highest level they can, and stay within a career. And so with that, I believe that's my last slide. I'm happy to, however format you'd like to take. I'm sorry. There was one thing that I wanted to mention that I apologize I wasn't able to put together. Is one of the other critical pieces of technicians around the point of care testing, and I wasn't able to get the state by state detail for you, as it's one we're looking at NVP in our survey of pharmacy law, to capture that better on what states allow technicians to do in an involvement with point of care testing. So I'm hopeful that with that we'll be able to in the future share more information relative to that across the states. So thank you.
Thank you very much. That was a wonderful overview of, the role and what our technicians do nationwide, Mr. Kova. I had one question. One of your early slides, you had something that said something to the effect of the safety record of technicians and immunizations. Do you have, did you provide any kind of document for us that kind of backs up, what as far as, the safety record, and or can you just speak to it? What did you find? Because when I hear that, that makes me think that that it was equal to or better than the safety record maybe of a pharmacist administering immunizations. So I don't know if you have any thoughts that you can comment on that.
Yeah, I think to be at this point in time, that's more anecdotal, based on information given by our member boards, through our different meetings and task forces on relative to reports of public health, breakthroughs or issues relative to delivery of vaccines via pharmacy technicians. So I think that type of data is actually, the specific data is more in development today. But again, and I appreciate you making note of that. It is more anecdotal, that we've not heard of complaints raised, to our member boards, that concern around technicians' involvement and any type of indication that there is any type of reduced level of delivery. Again, I would say it's at par, but to be able to make a claim that's done, in more a type of accuracy level of a pharmacist, I can't speak to that. But again, I think based on reports and what we've got from our membership, that's the I guess what I can frame it within today.
Okay, thank you. I'm gonna just go through each board member and see if you have any questions. Song, I'll start with you.
Thank you, Mr. Cover, for coming and presenting to us. I have a couple questions. So I understand that every state boards all operate differently, and you all do a great job of keeping up with everyone, with whatever you can with all 50 states, and it must be challenging. But I'm curious if there's a way for NABP to kind of share with us, or if there's a opportunity for you all to research on all these different states doing different rules and regulations, and obviously pharmacy technicians do different things, different rules. If there's actually corresponding correlation to reduce medication error rate, or is there some outcome that shows that the patient care is provided better with certain states, with certain regulation? Granted, I understand every board does their own thing, and their regulatory authority or power may be different. So I'm curious to hear that, if you have any insights into a possibility of understanding more on the outcomes with different rules and regulations of technicians. And the second is, I understand it may not be our purview, but I am curious if each states with different rules and regulations they passed and that allows techs to do certain things, if there's any corresponding tech happiness or wage increase that was shown, so more responsibilities that they're given more pay or something along the line, trying to see if there's any correspondence to that, if you have any. I understand these are not simple questions, so you're more than welcome to provide later on as well, but just wanting to get your thoughts.
Thank you. To your first question, that is one of the other things that came out of that work group that I mentioned from last August, that looking at, what things could be more permanent in expansion of technician roles, everything. And one of the other items within that report was really working with various external organizations that are focused on patient safety data and information that can really work to help identify, what are these things that can be accomplished, and in a safe manner. In addition, we had a task force relative to workplace conditions as well, and that also came out through that, as far as looking at again, some of the states that are using CQI programs. What are they collecting data, and really working to determine as additional activities or different functions are done by technicians, is there data that can help support those roles? And I believe there are some, we do have some that relative to the product verification. Again, we had a pilot, I know, in Iowa. I think there's some as well on the healthcare institutional side that could be brought out. But I'm making note of that from NABP as far as looking into that more. And then, sorry, the second question, can you refresh my memory?
Just wondering if there's been any correspondence to increased wages or increased happiness for techs doing more with states that have given them more opportunities to do further, expand their duties.
Thank you. Yeah, I think that in most cases I've seen is that in many cases, these are not the individuals that are vaccinating or doing, point of care testing and other things, are not your new hires, pharmacy technicians that are still just learning really the ropes as far as how to adequately function within in a pharmacy. So in many cases, I think pharmacies today have differing levels of pharmacy technicians, and the pay is kind of commensurate with some of those activities and what they're able to do. In some states, it might require additional training in order to do that. So I think the question is the and I mentioned briefly is that compensation high enough and enough to keep someone in those roles as a career path, and as cost of living and various other things and come into play, raising a family and being a technician long term. I think that's one of the questions is as their role expands, how does that compensation, is it adequate? Or do pharmacy technicians, they just have a lot of turnover and continue to move on? So I think that's a question many organizations are really looking at today, in respects of everything else. But I can tell you that from myself, I do work some part-time as a pharmacist, and I really have seen, there's technicians that they really enjoy, doing, the immunizations with COVID or doing the testing. I think it, just like all of us, I think we'd all like to have through our day, like to have varying things that we accomplish, and in many cases interact with the patient on a kind of a personal level with that immunization and different things. So I think it is very, I've seen it personally, that fulfillment factor, and also again, not just being, doing data entry for 4 or 5, long term. I think it's very, it's really good for those individuals to help in their development.
Thank you so much, Mr. Cover.
Absolutely, thank you.
Thank you, Song. Jason, do you have any questions for Mr. Cover?
I do. Thank you, Debbie. Thank you, Mr. Cover. Very informative to start off. In your presentation, you indicated that there was a working group assembled to review expanding the roles of techs in what are their current duties. Could you, and that working group unanimously voted to support permanent expansion of these duties. Could you please tell me what was the composition of this working group? Is it executive directors of boards of pharmacies? Who were these individuals, and in what states did they come from?
Yeah, I think the report that I shared with Ann, she can distribute to that as well, indicates the various individuals. It was a mixture of executive directors, board members, staff. So it was a varied group. I can bring that up.
So were techs included in this? Was there input included in this working group?
Yes, I believe. Trying to find the report now. Sorry, trying to see if I can pull up the attendance list. I'm having trouble with getting it pulled up. Al, and if you shared that with the other committee members, or.
Hi, yeah, so I don't know if this is correct, Bill, but it appears that the members included a representative from South Carolina, Kansas, Arizona, Massachusetts, Arkansas, New York, DC, New Hampshire, Arizona, and Wisconsin. I cannot tell from this if those are pharmacists, if they're board member pharmacists, if they're industry representatives, or if they're technicians. I don't know if that's detailed somewhere else in the report, Bill. I just looked at the members present.
Okay, if we could get that later, that would be helpful. I'm curious. I think that would help inform the committee. Regarding telepharmacy, 24 states currently practice. Is California included in that 24? Are these states operating under emergency waivers?
Yes, my knowledge,
Okay.
yes.
Okay, and then really thank you for the results of pulling out the comments from the APHA. They seem very similar to the information of the survey that we just conducted with our techs, and I think it just really speaks to the difficulty that techs have with working with patients and their desire for respect and appreciation for the vital duties that they perform. Thank you, Mr. Cover.
Thank you.
Jake, do you have any questions?
I had a question. Jason did ask that about the participation, so we'll get that information. Great presentation, Mr. Cover, and looking forward to making some of the changes. Thanks.
Thank you.
Cheryl, do you have any questions?
Yes. Thank you for the presentation, Mr. Cover. I just have questions about, I was looking at the article on our new practice model, and I see that they say the research may not be applicable to higher volume pharmacies and large chains because pharmacies in the study were small chains or independent pharmacies. Another limitation is the lack of full examination of the economic impact of these changes. I remember you saying that the bottom line is this is a new area. So I'm just wondering, so from state to state, they're not looking exactly at the same thing. For example, the tech, okay, and hospital pharmacy where it's unit dose, it's a little different from working in the community pharmacy. So is this still just a lot of research going on here, or are there regulations that are based on a little research or a lot of research with what you're speaking of?
So again, in specific to Iowa, and I think it was something that they worked on as a pilot project with their association, but it did involve, again, as described, some independent owners as well as some smaller regional chain. But these are, again, started as a pilot, but it is part of, it's in statute as well as regulations that that specify, the requirements, and again, I think in Iowa you have to present and gain approval of how it's going to be delivered in that specific within that specific organization or site. Now Arizona as well, those are in active regulation. So it's not a research. It's something that can be done today, regardless of type of practice setting. And I think that to be honest, I think one of the things that this in use in community practice settings is some of this is relative to an organizational risk analysis. Again, I think that pharmacists are ultimately, and from a board, in many cases, the board rules are ultimately held responsible for the safe dispensing of medications. So it is behooving on them to have individuals that are completing these type of product verification, and the environment and the tools that are tested and have QA around that to make sure that they delegate that to an individual and to a process that they are still held responsible for. And some some organizations I still are thinking you know, how that translates to them and their processes as it, you know, to protect you know, those individuals completing it. So, again, I just wanted to kind of bring that out as it going into more of the community practice settings is a more of a newer development.
Thank you.
That's all in there.
Okay, everybody good? So now let's move and see if we have any public comment. I just want to, as the public speaks, just remember we're talking only about this one agenda item. So, you know, kind of keep to the agenda item as the national perspective on the role and responsibilities of the pharmacy technician. We're going to be talking more detail about specific things. So let's, you know, make sure that we stay with what Mr. Cover has talked about in the national perspective. So I see someone creeping up towards the mic. Are they both on? Are both the mics on? Okay, perfect.
Apparently this is on.
Yeah, if you're interested, and we'd like to have your name, but you're not required.
Sure. My name is Shane DeSalle. I'm a professor of pharmacy at Touro and the author of most of the papers that you have before you today, or the editor of those papers. And I can actually answer most of the questions that you all had for Mr. Cover. And I'd like to thank Mr. Cover because he touched upon a lot of things.
Off. He just went off. You weren't touching it. I mean, we do appreciate the articles. I don't know if you submitted them. We appreciate the articles.
Okay. But anyhow, so I either authored or I serve as the editor of where most of those articles are published. And anyhow, in some of the questions that you asked, there actually has been an economic analysis that was undertaken. It was a positive analysis. It was not one of the papers, I think, that was circulated. Well, I did send a bunch of papers last week, and one of them was not. There's a few that were, some that were circulated, some that were not. There was an economic analysis done by Syntaine Snoswell. In terms of some of the, there is some data. It's very difficult from a scientific standpoint to be able to compare state from state in terms of incidence reports from a scientific design would be nearly impossible. So what has been done, of course, before, after designs and so forth, after the legislation has passed, the policy has passed and so forth, and all of those have been positive. In terms of more recent data, there are some data from Washington State that has compared pharmacists and technicians in immunizations. And I know you said you're going to get more specifics into that later. And there was some data in Idaho for the first several thousand. And again, both for pharmacists and technicians, both the incidence of any problems with regards to vaccine administration was basically significantly, I mean, statistically equal to zero. I mean, there was a very, very small number for both, but statistically equal to zero for both pharmacists and technicians. There was a little bit of discussion about technician happiness. And that's among the things that I primarily research. And it's not happiness. We actually measure motivation and we measure engagement and profession turnover and organization turnover, which is probably even more salient than happiness per se, but related to those. And we have found very significant differences among technicians who are engaged in these types of activities and higher levels of motivation, greater levels of profession commitment, less likelihood to call in sick, greater likelihood of having full staffing, which of course plays into safety considerations, which of course is the board's primary consideration. So I could comment on a lot more other things that we have, including technician level of pay. We haven't seen a corresponding increase in pay as a result of that. Well, there's some research I conducted about 10 years ago that indicated that there were 3 strata of technicians by pay. And there were actually those that were actually committed to the profession because of pay, or at least in part because of pay. Those were ambivalent as a result of pay, and those who are actually uncommitted as a result of poor pay. And there were only 75 cents an hour different between those 3 strata. So a total of $1.50 from like top commitment to like wanting to leave. And that was about 10 years ago, but that was about 75 cents an hour between those three strata.
And,
But
you know,
anyhow-
I hate to interrupt you because you have such great information, but I think at the beginning, we are trying to keep people to 2 minutes.
Sure, absolutely.
So, I don't know, you know, but you had a lot of information, so I'm hoping maybe you'll come back up and,
Oh, yeah, yeah.
and
I can't be here
piecemeal
all
to
day,
it.
but I can be here much of the day, and
Okay.
sure, and a lot of, any of the questions that you have about research, I'll probably be able to provide that for you during the course of the day.
We appreciate it. Thank you very much. So we are going to try to keep, comments to 2 minutes just so that we can, you know, hear as much from different people.
Hi there. Thank you, members of the committee. Mark Johnston, representing CVS Health today. Most of you know me as the former executive director of the Board of Pharmacy. I spent 6 years on NABP's executive committee. In fact, when Bill was a member of the Indiana board and not an employee at NABP, we were on the executive committee together. I've been a California licensed pharmacist for over 30 years, although I do live in Idaho these days. I will keep my comments to Bill's presentation for now, and I appreciate the opportunity to come back to the mic. You know, Bill did not mention tech transfers, tech verbals, tech clarification, because that's the old part of the tech movement. That's been happening for literally decades. It is still fluid. In fact, some of the stats that are in your materials don't represent recent changes, such as Alaska and Utah passing the ability for technicians to transfer. The real movement is beyond those basic duties. Tech check tech, to Cheryl's point, is actually old. Bill mentioned technology-assisted verification by a technician, where there's one technician and there's automation. There is no pharmacist final check. If we take that another step further, there's automation that doesn't even require a technician's check, but many states like Oregon require a certain percent of the product to be checked by a technician. Again, no pharmacist final verification. There's now states like New Hampshire and Idaho that allow techs to do final verification, period, not tied to technology. Again, no pharmacist final verification. And that's because these states are freeing up the pharmacists to do expanded duties. I've heard over and over again this board support pharmacist expanded duties, but really the two tie together. To be able to do pharmacist expanded duties, but he has to do the old duties, and those are technicians. Looking forward to coming back up. And
Hey, I have one question for you. Those states that expanded those duties, a lot of what you're, you know, allowing the pharmacists to get out there, did they tie? So I think in California we have tech, check, tech, and hospital, but the pharmacist they can only do it if the pharmacist is doing more clinical type services. Do you just off the top of your head, and if you don't know, that's fine. Did any of the states tie? We will do this, but we are expecting the pharmacists to be freed up and not just do it because.
No, the California rules that didn't quite make it are the only ones I were aware that had that type language in it.
Okay, thank you.
If Chair, I think one thing, the Iowa board and their part of their approval process is, I think that is the part of where they ask anyone applying that in your facility that you're going to utilize this, you know, what are some of the clinical services and things that your pharmacists are engaged in that will be enabled via, you know, your technicians doing the product verification. So Iowa does have a piece of the approval process that kind of incorporates what you just described.
So in Iowa, the pharmacy's kind of attesting that they would do additional clinical services in order to have tech, check, tech. And I don't want to put words in your mouth. Is that what you're saying?
That's one of the components is they want to see that, you know, the pharmacy, you know, are they engaging? Is it the practice saying that they're using it in? Is it patient-centered, you know, and patient engaged? and it's not just a closed door pharmacy that may not be doing clinical services. So I think they're kind of as part of that in their approval process, trying to channel this approach towards freeing up pharmacists to do additional, clinical tasks.
Thank you, Mr. Culver. I saw you creeping up. Are you interested in speaking? We'd love to hear from you.
Good morning. My name is Jeannie Lee. I want to thank Mr. Culver for doing that presentation, but as a public member asked the same question that I'm going to ask, is how many technicians were really surveyed on this presentation? And I'd like to know if anybody in California participated in this survey, because to me, it doesn't sound like it has. So that's my comment.
And just so you know, listen, stay tuned, because we did do a survey in California. We had, okay. Is there any other comment? Oh. Okay.
This was just related to the questions about the membership. He was talking about a couple of different groups. The latter group, the APHA group, was called a consensus stakeholder conference. So it was a very wide swath of persons. I participated. So there were members of chain pharmacies, NACDS, NCPA, academic researchers like myself, technicians, advocacy groups, and so just to clarify that was a very broad swath of individuals who participated from around the country.
But I think the question was both location and also jobs. So were they both pharmacists and technicians?
Yeah, there were pharmacists, technicians, patient advocates, researchers. I mean, it was actually a few hundred people.
Thank you. Right, that was the APHA meeting, not the NABP, which was what Jason's question was about. Okay, I'm not seeing anybody else in the location room that's interested in speaking, so moderator, will you open up to the public on WebEx?
This is the moderator. We've got our WebEx Q&A panel open. Again, if you'd like to make a comment, please click on that Q&A icon and send the word comment. If you're a call-in user, you may dial *3 to raise your hand. Our first comment comes from Jessica Crowley. And it looks like Jessica, oh, there she is. Jessica, I've sent the request to unmute your microphone.
Your time today. I would be curious to know for the other states, and I know every state is different in terms of whether a technician has to be nationally certified, but I would be curious to know if all of the technicians that do perform check tech, or that do vaccinations or expanded vaccinations, are they nationally certified technicians? I know you did mention that, of course, they're not new technicians, but that's a question I had. And I do just have one last comment. Unfortunately, I can't stay on for the entire meeting today, but I will say, as someone who has other pharmacist friends in other states, one of the concerns that comes up is, you know, when we're in a vaccination room, a lot of the times technicians will have questions, consultation questions in the actual room. So it's kind of a barrier that creates more work for the pharmacist, where the technician has to come back and have the pharmacist do a consultation before going back in the room. But I thank you all for your time today.
Thank you.
Thank you. Our next comment comes from Diana. Diana, I've sent the request to unmute your microphone. right, looks like hers was audio issue. My apologies. Our next comment comes from Sandra Gukian. And Sandra, I've sent the request to unmute your microphone. You will need to click on the unmute me button that appears at your end. Again, Sandra Gukian, if you can please unmute your microphone. All right, I will circle back to Sandra. Sandra, do you see a pop-up that appears at your end with an unmute me button on it? You'll need to click the unmute me button.
Hear me now?
We can hear you now.
I think it was obstructed by another window open. My apologies to the board. Thank you very much for this opportunity. I just wanted to provide a little more additional background on the Iowa project that's been raised several times. And I would be happy to send this information to the board as additional background. But Iowa's project was really about a new practice model in the state. So what their goal was to free up pharmacists' time to provide clinical patient care services. And the facilitator of that was TechCheck, as has been discussed today. So what I would draw the board's attention to is there was an article published in the Journal of the American Pharmacists Association. And that article actually talks about how the pharmacists spent their time that was freed up with this new practice model that was being tested. So I'm happy to send that, and I believe that will answer some of the licensing committee members' questions that were raised earlier in the call. So there is additional information that I believe would be helpful, and we're happy to submit that.
Yeah, thank you. I feel like that's one of the articles we might have in our, because there was an article in there about the Iowa. But if it's not, then which one is it? What's the title of it? Is it the Optimizing Care title? I think I heard that sometimes they can't hear us, so make sure your mic's on.
Yeah, the article that I was questioning was the Iowa New Practice Model, Advancing Technicians' Roles to Increase Pharmacists' Time to Provide Patient Care Services. And what I was reading from was the limitations and that the findings weren't applicable to similar pharmacies within Iowa. However, because of the differences in pharmacy practice acts and technician training requirements in other states, they say the findings may not be fully applicable to similar pharmacies in other states.
Okay. So it's, I think that might be the article that you're referencing on WebEx. It's Journal of American Pharmacists Association. I'm trying to see which date it was, but it was by Michael Andreski, Megan Myers, Kate Gaynor, and Anthony, where's the date? Oh, there it is, from 2018. Is that the article that you're referencing? Is she still on?
Yes, she just unmuted me again. Yes, that's the article.
Okay.
But I was drawing attention to the part of the article that asked about how the pharmacists used their time when they were relieved of the additional the rudimentary tasks associated with prescription processing. So there had been a question earlier about what did pharmacists do in Iowa when their time was freed up. And so I was just drawing attention to that section of the article that talks about the clinical services that were provided by the pharmacists through the new practice model test.
Okay, thank you.
Okay, and our next comment comes from Sarah Miles. Sarah, I've sent the request to unmute your microphone.
My name is Sarah Miles. I'm with UFCW, Western States Council, and I just wanted to add that while the sense of work fulfillment is important for workers, compensation needs to be directly proportional to responsibility changes and responsibility growth as you consider this proposal or these proposals. Thank you.
Thank you.
Our next comment comes from Keith Yoshizuka. Keith, I've sent the request to unmute your microphone.
Can you hear me now?
We can.
Okay. Keith Yoshizuka, California Society of Health System Pharmacists. I applaud the board for holding these hearings. I encourage the board that, if we're going to expand technician duties to free up pharmacists, that there be something in the that there be some requirement so that pharmacists, basically it's not just to provide additional time so they can fill more prescriptions, but there should be some requirement similar to the inpatient venue that clinical services be provided, not just offered, but actually undertaken. Thank you very much.
Thank you, Keith.
Our next comment comes from Christina Randolph Martell. Christina, I've sent the request to unmute your microphone.
August 2021. The bottom bullet point says, in addition, members agreed that pharmacists can delegate various activities based on the individual technician's training, skill level, and experience, but excluded clinical care activities. Could I, as a technician that works to support a pharmacist in a clinical setting, can we elaborate on why that was excluded?
I'm sorry, can you repeat that question?
I've sent her a request to unmute.
Really, the end of that comment where or the bullet point, it says that clinical care activities were excluded. Can we elaborate why clinical settings were?
Yeah, I think I can answer that because I was on that part of that work group from the association standpoint. But yeah, so you're referring to, where it says that the members agree that the pharmacist can delegate various activities based on the individual technician's training, skill level, and expertise, but excluded clinical care activities. So what that really meant is, and in many states have varying ways in which they allow technicians to operate. Some go by way of the listing everything they can do, and others say that they can do anything in the pharmacy except for activities that are specific clinical ones that must be completed by a pharmacist. Again, I think what that work group was focused on are those activities that are, again, more specific to clinical, DOR review of the patient's medication, counseling, those that are universally accepted as clinical services that should only be conducted by a pharmacist. So as you're kind of relating that it's technicians that support many of these clinical care activities, such as point of care testing, immunization, that's not really the intent of that statement. It was just a made of kind of that it would exclude those things that are kind of across the state universally accepted as only to be delivered by a pharmacist.
Thank you.
Sure. Thank you.
Thank you.
Our next comment comes from Jessica Langley Lope. Jessica, I've unmuted your microphone or sent a request to unmute your microphone.
Answer or asked earlier about
Jessica, I'm sorry, this is the moderator. You're really quiet. Can we ask you to get a little closer to your microphone, maybe?
Sure. Can you hear me better now?
Seems to be about the same.
I
Are
will
you
try
able to hear her clearly in the hearing room?
No.
Okay, I will try and yell. Maybe that will be better. I wanted to address the questions earlier around certification requirements for immunization.
We still can't really, I'm sorry, Jessica, just one sec. Is there a way to turn her up in here? Okay.
That any better at all?
Yeah. Good enough. Give it a try, Jessica.
Okay, I apologize. We might need to reconsider that for my presentation here in a minute. I wanted to answer the question around certification as it relates to technician immunizations. It was asked if the states are moving towards requiring certification for technicians who are doing that, and I just wanted to note and revert back to PrEP Act language that uses the term qualified pharmacy technician, and they define that as really basing off the guidance for each individual state and whatever licensure or registration or certification requirements they have in place should be followed. But there is a caveat that says if a state does not have any licensure or registration requirements in place, that the technicians must be certified and have a CPHT credential in order to give those immunizations. And I think that we've seen that most of the states that have adopted permanent language have followed similar language to what was listed in the PrEP Act.
Thank you.
And with that, I'm not seeing any other requests for comment at this time.
Okay. Any other comments from the board members? Okay. Thank you for the comments. I'm going to move on. Do we need to take a break? Is everyone okay? Okay, let's take 5 minutes. Okay. So it's 11:30, so we'll reconvene at 11:35. Okay, well, I was hoping recording, but same difference. So we're on agenda item 5, which is discussion and consideration of requirements. Okay, let me do roll call, and this time you don't have to tell your license type, just your name.
Cheryl Butler.
Jig.
Jason Weiss.
Song O.
Debbie Veal. So we are all back, and we're on agenda item 5, discussion and consideration of requirements for licensure of pharmacy technicians, including presentations on the examination and training programs, which is one of the things that came up a lot in our listening sessions. So just kind of maybe a tish bit of background. We have these 2 agenda items. That's the goal is to add information so that when we get in talking about job duties, that we kind of have a little bit of background. So we actually are going to have 3 presentations. They're all maybe 5-ish minutes. And at the end of the 3 is when we will then take questions and from the board members as well as comments from the public. So our first presenter this morning still is Ryan Burke, who is Director of Professional Affairs at the Pharmacy Technician Certification Board. Is Dr. Burke available, moderator? Looks like we've got his presentation up.
Here.
Great, thank you. Dr. Burke, your floor is yours.
Thank you, Chairperson Veal, and good morning, everyone, and thank you for the invitation to be here and participate in the summit. I just want to briefly talk to you about some of our credentials at PTCB with a particular focus on our Certified Pharmacy Technician program. So as a little bit of very quick history, PTCB was founded in 1995 by 4 pharmacy associations, including the state associations in Illinois and Michigan, as they were really the pioneers in knowledge assessment for pharmacy technicians. And they came together with APHA and ASHP in the early 90s to eventually create PTCB in 95. And then in 2001, NABP joined our board as the 5th governing organization for us. And so our mission at PTCB is very much aligned with that of boards of pharmacy, and it all has to do with medication safety and protecting the public. So on the next slide, there's just a very quick snapshot of a little bit of our history. And one of the things that I just want to call your attention to is the fact that there are about 20,000 PTCB certified pharmacy technicians in California. I know you'll hear from Jessica next, and if you combine both PTCB's numbers and what I might guess is NHA's, and Jessica can correct me after the fact, is that about 30% of the technicians in California are certified. And to give you a sense of where that falls in the spectrum, on the low end, we see states that have about 20 to 25% of their technician workforce certified, going up to about 80%, particularly in the states that require certification as a condition of being registered or licensed by the Board of Pharmacy. So on the next slide, this is where we get into our Certified Pharmacy Technician program. So the CPHT credential has been around since our founding, and there have been a few different iterations of the exam content outline, as well as the eligibility criteria. And so the eligibility criteria that you see here on the slide went into effect in January of 2020. And this was after many years of engagement of stakeholders, really going back to 2013. So really 7 years of work went into getting to the point of having this eligibility criteria, as well as the content outline that I'll talk about in just a moment. So there are 2 eligibility pathways currently for a technician to sit for our exam. One is completion of a PTCB recognized education and training program, or having equivalent work experience, which we pin at 500 hours. We have about 1,500 recognized programs across the country, and I'll talk in just a moment about what types of programs those are. Next slide, please. We have requirements in place in order for organizations to become a recognized training program with PTCB. And really the key here is that the curriculum has to align with the knowledge that we have identified as being required for an entry-level pharmacy technician to practice. And so the knowledge supplements the PTCE content outline. And then in terms of the types of programs, any program that is accredited, and I know that Lisa from ASHP will be here as well, those programs are automatically recognized. And then any non-accredited program has to go through an attestation process where the program director is attesting that their curriculum covers those knowledge requirements that I mentioned. We do have an audit process in place to ensure that people are being truthful and that these programs are actually complying with what the requirements are. And I just want to be very clear that our recognition process is different from and separate from accreditation. It is not intended to be accreditation, and it does not provide the same level of rigor that accreditation offers. Next slide, please. I noted earlier that we have about 1,500 recognized programs today, and the type of program really runs the gamut. We have high school programs, we have community college programs that lead to an associate's degree, there are certificate programs, there are online programs, there are in-person programs. There are third-party curriculum providers that actually license their curriculum to 100+ schools. That might be high schools, that might be other types of programs. And so on our website, we have the full directory of all of the training programs. So if you're curious to see if you recognize any names, or if you're curious about the program specifically in California, I would be happy to provide that list. It is also accessible on our website. On the next slide, you can see at a very high level what's covered on the pharmacy technician certification exam today. As I mentioned, we went through a major revision of this that launched in 2020. And this content outline is based on a 2016 job task analysis of more than 40,000 practicing pharmacy technicians. And the intent here is that the knowledge required of an individual to pass this exam reflects the knowledge that is required to practice at the entry level across pharmacy practice settings. If you compare this to the older version of the pharmacy technician certification exam, you'll see that there are fewer knowledge domains. And that is really because we removed things that were specific to one practice setting or another. And so to give you an example, in 2016, with the most recent job analysis, sterile compounding was identified as something that, for the most part, is not applicable at the entry level across practice settings. It's typically seen more in health systems, for example. Similarly, billing, which was previously covered on the PTCE, is something that, at least our version of that content, was very specific to community practice. And so the goal with this content outline is really to reflect the knowledge that's required across practice settings and not be focused on one specific setting over the other. On the next slide, I've provided just a quick overview of the recertification requirements. So in order for a technician to maintain their certification through PTCB, they are required to earn a minimum of 20 hours during their 2-year recertification cycle. At least 1 hour has to be in pharmacy law, and then at least 1 hour has to be in patient safety. We generally, most technicians earn CE from accredited providers, and we require that CE to be specific to pharmacy technician subject matter. However, in late 2020, in response to a lot of feedback that we received from technicians about the inability to sometimes find either free or low-cost CE programs that had that T designation, we do allow up to 5 hours to be P-specific. That means designated for pharmacists, as long as the subject matter is still reflective of knowledge that's contained within the PTCE content outline. On the next slide, this is just giving you a quick overview of how pharmacy technicians recertify. This is something that we have really streamlined in the last couple of years, thanks to our integration with NABP's CPE Monitor. You don't have to really get into the details too much here with the process that a technician goes through, but I think what's important for you all to note is that we are effectively auditing 100% of recertification applications through this process. So using that integration with CPE Monitor, we're actually verifying that people have earned the CE they say they have earned. And in the very rare instances where people are earning non-accredited CE, our operations team is actually manually reviewing those programs to determine that they meet the requirement that the content is specific to pharmacy technician subject matter. On the next slide, this is where I will very briefly talk about the other credentials that we have created in recent years. We now offer a suite of certificate programs for technicians that are focused on various areas of knowledge that are either specialized to a practice setting, for example, or specialized to a role that they might have in a given practice setting. And so you can see the list of currently available programs there on the slide. On the next slide, this provides you just a little bit of history about how we arrived at creating assessment-based certificate programs. So a number of years ago, we were having conversations with stakeholders about how do we create an advanced certified pharmacy technician designation. And what we considered was creating one exam. So we would have the PTCE for the entry level and then we would have this advanced exam for more specialized roles. The challenge, as you all probably can imagine, is that identifying a single body of knowledge that is reflective of advanced practice was not really feasible because there's so much variation in roles, in particular, variation as you look across the states in terms of what regulations allow. And then, of course, from practice setting to practice setting, what is considered advanced varies greatly. And so the assessment-based certificate program approach provides flexibility to, of course, pharmacy technicians, but also to employers and educators to determine what's necessary in terms of knowledge for certain jobs and certain duties. And then finally, on the next slide, this is how a technician can earn that advanced certified pharmacy technician designation from PTCB today. So the first criteria is that you are an active PTCB CPHD, so you've earned that entry-level credential. And then completing at least 4 certificate programs or having the sterile compounding credential and 3 certificate programs. And finally, having 3 years of work experience within the last 8. We have about 800 individuals that have attained this advanced designation since we made it available about a year and a half ago. And we do have many more in the thousands of technicians that have taken 1 or more of those assessment-based certificate programs. A number of them have taken 2 or more. And so we're slowly starting to see the number of advanced CPHTs build. We are very slowly beginning to see employers incorporate these credentials into career ladders and job descriptions. The big question, of course, which I know I've heard in the public comment period remains, how does that track with compensation and ability to move into some advanced and specialized roles? And so that's something that we keep track of closely. We are planning a large workforce survey later this year, and we'd be happy to share the findings of that workforce survey with the board, because I think that we should gain a lot of insight into how these credentials are actually being used in practice through that workforce survey. And with that, my final slide just has my contact information, and I would be very happy to take any questions that you all have about our programs.
Thank you, Dr. Burke. We're going to actually, I'm hoping you can stay on, but our plan was to do all 3 presentations and then have people ask questions, going to comment at that time. Are you able to stay on for a little bit?
Yes. Yep, I will be here.
And I think we will take you up on your offer to provide the programs that are available in California. So if you could submit that to our executive officer, we'd appreciate that.
Yes, will do.
Okay, and our second presentation is by Jessica Langley-Lope, who's Executive Director of Education and Advocacy for the National Health Career Association. Ms. Langley-Lope, if we can connect with you, the floor is yours.
Hey there. Thank you, Chairperson and board members. Can you guys hear me a little better this time?
Yes, we can.
Oh, perfect. I'm glad I got that fixed. Thank you for the time today. I'm excited to be here with you today to share some insights around the National Health Career Association and our pharmacy technician solutions that we offer, including our EXCPT certification exam that awards the CPHT credential. If you don't mind moving to the next slide, please. NHA, just a little bit of history about us, is we have been a national provider of accredited certification exams since 1989 and have actually awarded over 1 million certifications. However, that is not just within the pharmacy technician profession. We, as an organization, actually serve multiple allied health professions, which allows us to kind of have a 30,000-foot view over healthcare, its industry and workforce needs. But with one of those areas, large areas of focus for us is around the pharmacy technician profession. And we do everything from creating our tools and resources, along with our certification exams, to help people really access a better future within their healthcare journey, and that is our mission. You want to go to the next slide? These are just a couple of bullet points that help explain the expertise level that we have across healthcare training and assessment. I'm not going to go through those, but a lot of them help build strength around us being able to offer accredited examinations and other training resources and materials based on the type of professionals that we have on our staff and embedded within our company culture and things like that. Next slide, please. I don't need to share with everyone in the room why we're all here and why we have conversations that are so important like this one, but we do every year do research, profession-based research. This is a little snippet of what we did last year in 2021, and we will be releasing our pharmacy technician profession research that we've done this year here pretty soon, but I just wanted to kind of identify a couple of drivers here that we could be looking at as an industry, similar to some that have been shared throughout the session. We know technicians are taking on more advanced skill sets, needing to work to the top of their license to free up pharmacists. We also report that pharmacy technicians may sometimes lack those essential skills or professional skills, definitely something to consider. And then we also know that traditionally certification has been one of the main screening criteria for pharmacy technicians when applying. However, we also know today that we are experiencing an incredible workforce shortage, and we know recruitment and retention efforts are top of mind currently across the profession. So go to the next slide. This is a wonderful visual of all the things that NHA does to support the pharmacy technician profession. Unlike my friend Ryan over at PTCB, the EXCPT is only one piece of NHA's puzzle and how we look to support technicians from every entry point within their kind of learning and professional careers. So if you kind of look at this graphic, and I'll go into just a little bit more detail as we move through, but NHA actually offers entry-level career training. It is an online didactic tool called PharmaSeer. We also have a subset of that is called PharmaSeer Math, as we know that oftentimes the math dosage calculations is the lowest scored area on a national certification exam. And so we've created a resource that helps with that. We then have very robust certification preparation materials, an online study guide with practice exams, and then of course the EXCPT exam that awards the CPHT credential. We're also continuing post-certification to offer continuing education and advanced training options for our certification holders as well. We'll go to the next slide. This slide just shows you a little bit more detail, kind of the learning life cycles, and it lists our products and services through that kind of growth cycle. So in the learning phase, you can see our PharmaSeer and our PharmaSeer Math. And very quickly, going back to one of those bullet points that I showed on a previous slide around technicians needing assistance with essential skills, professionalism, we call them all sorts of things. We created the first simulation-based program that actually helps people identify some of the core components of professionalism and essential skills, things like communication, empathy, team building, which has been very successful to be used in high schools and also schools and even by employers, because oftentimes we know this is the first encounter, someone who comes into the pharmacy technician profession, that they may have in a professional setting, or more importantly, in a patient-facing setting. And so needing to give them that background information and allow them to explore how to engage and interact with others in a safe, simulated environment has proven to be really beneficial for people coming in and entering into the profession. You can see as we move along through the CE and advanced skills, the different types of partnership offerings that we have in collaboration with some of our strategic partners. Looking at things similar to the assessment-based certificate programs that PTCB is offering around immunization, point-of-care testing, and also looking to build more meaningful CE, continuing education, that allows technicians to move away from that mentality of I'm just entering this as a job, but staying in it for a career. So if we can purposely build skill sets upon one another to help them move towards a specific role or duty or function within the pharmacy workspace, we think that'll be highly beneficial with technicians, not only from an engagement, but from retention and advancement perspective. Next slide, please. We do oftentimes get asked around the recognition and acceptance of the EXCPT. The EXCPT has not been circulated in the pharmacy profession arena as long as the NADP, or as long as the PTCB. This does kind of show our journey and the work that we've done over the last couple of years. And since 2020, the EXCPT does maintain and have recognition and acceptance in all 50 states. Most of those states came with having to do intensive approvals and review, kind of reviews of the exam itself. And so we're really happy with that outcome. Next slide, please. Ryan went through their eligibility requirements that are outlined through the PTCE. They are similar for the EXCPT in a sense that we have multiple pathways that an individual can go through in order to become eligible to sit for their national certification exam. As mentioned, we know that there are multiple entry points, whether they come through a high school program, a traditional education program, work-based learning or employer-based program, military, etc. And so we want to make sure that we are able to meet them where they are based on their background and the training that they have captured. And so we have those eligibility requirements listed here for your reference as well. Next slide. We would also like to give you a snapshot of the exam kind of outline or content items that are covered through the EXCPT. We as well have 4 different domains recognized, and you can kind of see the breakdown. Our exam blueprint can also be found on our website that has a much more comprehensive knowledge, skills, and ability outline associated with this. And similar to the PTCE, it is based off of a national scaled job task analysis where thousands of industry experts come together to ensure that we're capturing all the knowledge, skills, and abilities needed for an entry-level pharmacy technician to practice in any pharmacy setting. And our exam was also recently updated based on that job task analysis back in 2020. So I mentioned I'm not going to go through these. I just wanted you all to have these for reference. But outside of just offering the EXCPT exam, I think it is noteworthy to promote and share some of the other resources that NHA does provide to schools and employers and individuals wanting to pursue a career as a pharmacy technician. This shows a little bit about Pharmaseer. It is an online didactic tool that was developed to meet the didactic requirements of an ASHP accredited program. So I think that's very important, and it kind of has the details there listed of the learning options that are offered through the tool as well. And we've seen a lot of schools and also employers use this as their main or core didactic or educational tool for their training programs. Next slide. This will give you a snapshot of Pharmaseer Math. If you want to go to the next slide, sorry. Pharmaseer Math, it's got 5 modules. It's much shorter because it's condensed curriculum focusing just on those specific items with dosage calculation and such. And it's very interactive and has really made a difference. We've seen with clients or individuals that have used this resource, the scores have gone up significantly in that area on our certification exams. The next one, you go to the next slide, is personability. just some details here around this product and how the learning process moves through this particular product. Again, they are able to watch and play out different scenarios and select how they would respond to the situation. We then score them on their responses at multiple points within the product, and they're able to, as I mentioned, in a safe environment, really see what the best responses are based on the scenarios that they can choose, and that gives better output when they are directly in the pharmacy working and having both employee to employer or patient communications. And then lastly, I just want to anchor the products with the fact on the next slide that we do have performance data and analytics reporting that goes across all of these products and tools. This allows, if you are an educator or perhaps a training coordinator, to have really robust and detailed visibility to how individuals are working through the different products, from the amount of time spent to the level of engagement that they're having or interaction that they're having in the tool, along with scores. And even as a part of our study guides, it does give people the ability to group them into certain areas, letting them know how successful they would be on the national certification exam based on their performance and scores throughout the different tools. And then lastly, I just want to highlight a little bit about the fact that NHA prides ourselves a lot in doing advocacy for pharmacy technicians, and we do that in multiple ways. If you go through the next slide, this kind of shows you an example, next slide as well, excuse me. An example of the different types of industries and people and groups that we associate. And we truly believe that having a stronger system of support for different healthcare professionals ultimately leads to better patient care and better quality of care being delivered. And then finally, I just want to give a couple of examples here on the next slide about some of those advocacy efforts. You can see here there are multiple items listed. One of the important ones is NHA helped lead the development of a national coalition for the advancement of pharmacy technician practice. It's made up of various organizations from all pharmacy settings, national, state representatives, retail, hospital, academia, education, all coming together to try and have a larger voice. Traditionally, what we would do is when there are state-specific topics on the agenda that impact technician scope of practice or such, you might traditionally see a letter of support coming from the coalition or other activities such as that. So we're very proud of that group and the work that it's doing. We also have OnScript podcast dedicated to technicians. We also have a strategic partnership with Pharmacy Times, to where we have created, in combination with them, a digital kind of workforce center for pharmacy technicians that houses data, research, articles, all sorts of webcast and podcast webinars, all strategically focused on pharmacy technicians and their practice. We also now, in combination with Pharmacy Times, produced 2 pharmacy technician supplements. So these are smaller magazines. Everyone, I'm sure, is familiar with the monthly magazines that come out via Pharmacy Times. But we have 2 specific supplements that are now being delivered in the spring and in the fall that are 100% dedicated to the work of pharmacy technicians. Articles are written and submitted by technicians. Technicians are highlighted throughout the supplement. And so we think that's a wonderful opportunity to really show the value of technicians and provide information about the changes that are happening within their profession. And then, of course, just other links there for you all as a reference to use in the future as well. And then you can just run through the next couple slides, and my contact information is also listed on the last slide as well. I'm happy to take questions after the third presentation. Thank you.
Ms. Langley, we appreciate your presentation. It was very informative. Now moving on to our third presentation, which will be provided by Lisa Lifshin, who's the Senior Director of Pharmacy for Technician Accreditation with the American Society of Health Systems Pharmacists. Are we able to connect with Ms. Lifshin?
I have her promoted to a panelist. Lisa, you should be able to control your own microphone. It looks like you might be called in. If you do, you can use *6 to unmute. And if you're connected by both computer and phone, you'll need to unmute both devices and then control your microphone from your computer. Lisa, are you able to hear us? It looks like you've called in on your phone. You will need to do *6 to unmute your microphone.
You hear me now? Now I can't see anything that was on the computer, and I can't see anything that was on my phone either, unfortunately.
We can hear you, and
right.
your presentation is up.
But I can't see it, unfortunately. It was like it was disconnected. I can certainly read from my presentation. Let's see if it's coming back up now. I don't see it now. I had it, and then it went down. Okay. How can we do this?
Well,
This
if
is
you
the
have your
co-moderator.
presentation, we can. So we're looking at your, opening page. If you just, you have your presentation, so you can just kind of speak to us and tell us when to tell the moderator when to switch pages, and I think we'll be able to be in sync.
Okay. All right,
Yeah.
that works for me. Okay,
This is
I'll
the
tell you. Okay,
co-moderator. If you tell me
Yeah.
a slide number, I can go to it easily.
Okay, I'm sorry about that. I had both of them up there, but I guess I'm having a computer malfunction. I apologize for that. My system doesn't work well with WebEx, unfortunately, but I had them both on and then they clicked off. But thank you for inviting me today. It's exciting to talk to the California group. We've been working with you for a very long time. I've been with ASHP for about 26 and a half years. And we've been working with the Health System Pharmacist group, I think, ever since I've come to ASHP. So thank you for inviting me. So today I'm going to talk a little bit about in this next 10 minutes, and please feel free to contact me afterward because I'm sure you'll have a lot of questions on ASHP, ACP accreditation standards for education and training of pharmacy technicians. And that's my first slide. I'm going to go to slide number 2 now. This is sort of the same thing that Ryan went through. There's various types of pharmacy technician education training programs. There's certificate and degree programs, College of Pharmacy associated programs, and there's going to be more of them. Employer-sponsored programs in the health systems. That's growing now due to the workforce shortages. We have them in the retail environment, whether it be the Walgreens, CVS, or now more and more of the supermarket chains, high school programs, more in the high schools, especially because of the legislations in various states, and we'll talk about that more. Military programs, there's some in certificate review courses, but they're really not ones that are accredited, distance learning programs, and even more. Just a little bit of history as well. ASHP has been accrediting technician training programs since 1983 on a voluntary basis. We also accredit pharmacy residency programs for pharmacists. We've been doing that since 1963. We have about 2,900 pharmacy residencies, and we have about 250 pharmacy technician training programs that are accredited, and that number flexes and fluxes a little bit here and there. We had a lot more until many of the proprietary schools closed. You know of a lot of them in California, the Everest, Healed. We probably had about 40 or 50 of them before they closed, and a variety of others that are in different parts of the geographies in the country. There are about 22 in California, 22 that are either entry and advanced, and of those, 8 are advanced and entry, and then 4 of them are just advanced of the 8 of those. In 2012, NABP requested for ACPE to participate in pharmacy technician education and training accreditation. And that was really, you know, in the past, ASHP was called the American Society of Hospital Pharmacists, and then we changed to Health System Pharmacists. And now, you know, with everyone going with shorter names, we're ASHP. And there was this persona that the accreditation was for hospital programs, but our standard was for everyone. So ACPE looked at it and felt, well, geez, the standards are fine. You know, there was really nothing to be changed. And we formed a collaboration in 2013. And they reviewed our standards, guidelines, procedures, and we formed an organization or this partnership or this collaboration called the Pharmacy Technician Accreditation Commission. And this commission is a group of pharmacy technician educators, pharmacists. We have the president-elect of ASHP and the president of ACPE on this group. I serve as secretary of the group, and these individuals are appointed by ASHP and ACPE, and they're the leaders in pharmacy technician training and education. And they really set the stage for the standards development, quality of pharmacy technician education and training, and they review all of the programs that come up for accreditation, their reports in the interim of reviews, and meet twice a year. So they vote to recommend on all of these actions, and the final approval of these actions go to both the ASHP and ACPE boards. So the first time that they met, it seems like just yesterday, but it was in June 2015, were the first actions that were approved or voted to recommend by these groups. So the group is pretty mature now. They're doing some really exciting things, and I'll tell you a little bit of the things that are going to happen at our meeting in May. They meet in October and May, so we're getting ready to meet in a couple weeks. So the purposes I had mentioned really of standards are, and this is slide number 4, I'm sorry that I'm going on, is to protect the public by ensuring the availability of a competent workforce. We'll describe the entry level and advanced level, and providing criteria for the evaluation of new and established education and training programs, and promote the continuous improvement of established education and training programs. And that's really what these standards do. In the past, we had one level of education and training, and that didn't really fit all. And there was a stakeholders conference, a consensus conference in 2017, and that really looked at the role of the technician, what a technician is, and the group, representatives from the California Board of Pharmacy were there, as well as about 300 other representatives from all aspects of pharmacy, from all of the states, from different other stakeholders that weren't pharmacists, and it was a 2-day session, and it was really pre-virtual, but people did come in virtually on that, and they came up with a few things that they came to consensus, that there should be an entry-level technician, that technicians should be nationally certified and be either registered or licensed in their state. So that was now 5 years ago. So the standard itself, there are competency expectations. We now, instead of having one standard where the program is a 600-hour program, we now have an entry-level program, and this is really, as it is, an entry-level for a variety of contemporary settings, and I'll tell you about the length later in this presentation, and an advanced level. And the entry-level programs are generally, for the most part, for the retail setting. And the advanced level is more so for the hospital, home infusion, for those the technicians that are higher up the career ladder, that supervise other technicians, that are more for advanced roles. They get trained beyond that, require additional knowledge, skills, behaviors, and abilities that are beyond the entry-level pharmacy technician. And that was slide 5. Slide 6. There's 3 sections of the standards. Section 1 includes standards 1 through 5, the competency expectations, and we'll go through them. Section 2, the structure and process to promote achievement of the competency expectations, and that's standards 6 through 13. Section 3, the assessment of standards and key elements, and that's standards 14 and to 15. And all of these things are on our website, the ASHP website. And again, if you have questions, you can certainly contact me after this. And we have a great website for accreditation on the ASHP website that includes standards, a model curriculum, guidance documents. We now have webinars on how to become accredited, what happens if you're getting ready for a survey. After a survey, they're coming online next month. One of our fellows put them together, how to develop a strategic plan, how to develop an advisory committee. We have a tech tablet that's news from each of our advisory committee meetings, and that comes out generally in March and usually March and August each year. So we really are expanding the information that comes out for our tech educators. So slide 7, section 1, this is really the meat and potatoes. Section 1, the competency expectations. Standard 1, and each of these have key elements, and they're broken down into key elements for an entry-level training program, an entry-level technician, and an advanced level. And if someone's being trained for entry-level training, they can still have, I usually call them elective key elements. If you want to add some for the advanced, you can, but still be reviewed as an entry-level program. And if a program applies for entry-level program, they can come back later without an additional fee to apply for an advanced level program. They can apply as both types of programs. So the flexibility is there. You can change your mind at a later time, and we'll adjust accordingly. If they apply for an entry-level program, then we'll come back or review via paperwork what they did to become or want to become an advanced level program. If they applied as an advanced level program and want to add an entry-level program, we'll just add that on because they've already been reviewed for that. So there's various things that we look at. And the things that we look at when we revise the standards, which are generally every 6 years, we review the areas in the ACCEPT exam and the PTCB exam to ensure that we're up to date. A standard is really more than up to date. We're writing the standards for a few years out because we don't want the standard to be dated. We want it to really be following things in advance. For instance, we have things about immunizations. We have medication reconciliation, before technicians were really doing those things. And people will ask, well, we don't do that in our state. Well, this is a national standard, so we want them to be trained to be able to do this. So if a technician goes to another state and you're hiring this technician and they've completed an ASHP, ACPE, and accredited program, an employer can look at the standards and know what they have fulfilled in their program to be a graduate. So there's personal and interpersonal knowledge and skills, foundational professional knowledge and skills, processing and handling of medication and medication orders, patient care quality, safety knowledge and skills, regulatory compliance knowledge and skills. So again, this is, as I would say, this is the dinner. So this is the main part of the standard. Slide 8, section 2, the structure and process to promote achievement of educational outcomes. Standard 6, authority and responsibility provided to the program director, the strategic plan, Standard 7, the advisory committee, Standard 8. All programs must have an advisory committee that meets twice a year, the curricular length for the entry level and the advanced level. Section 2, this is probably one of the areas that is most of interest to you as well. The entry level must be at least 400 hours in duration over at least 8 weeks, with at least 300 hours divided into didactic, 120 hours, and it can be live, virtual, hybrid. Simulation, at least 50 hours, and that is hands-on. They need to have hands-on training, whether it be in the lab or some of it can be taken home and then be assessed virtually, via WebEx, if their WebEx works, or Teams or the like, or some mix thereof. Experiential, 130 hours. And in the, a big thing to recognize in the entry level, they have to have one externship site. So one externship rotation. And generally in the lab, there for an entry level, we have some programs that teach and train in simulation hospital activities, IVs, etc. But generally, for the most part, the lab is for the retail environment. So whatever they're going to go out on externship, they need to learn that in the lab because the sequence is see, practice, do. And but in the didactic, all programs and even the entry level must learn all types of pharmacy, retail, and hospital from a didactic standpoint. The other 100 hours can be all didactic, all simulation, all experiential, or any combination thereof. The advanced level is 600 hours over 15 weeks or more. So basically the entry level plus. 460 hours divided as didactic 160, so 40 hours more than the 120 in the entry, 100 simulation, 50 more than entry, experiential 200, 70 more than the entry. And this is 200, they must have 2 different practice type experiential programs. They can't have 2 retail. They can't have 2 hospital. It has to be a mix so they can have a variety to learn what they want to do in practice. But for instance, say they you get them a rotation or they get a rotation in the health system or a VA, for instance, where they can do ambulatory pharmacy and a hospital environment. So they can stay in the same place as long as they have a mixture or 2 type of rotations in that environment. And that would be really great. So the other 140 hours can be allocated as the program director and faculty see fit. Okay. Slide 10, section 2, structure and process to promote continued. Standard 10, the curricular composition and delivery. Again, as I had mentioned, at least 1 experiential rotation for the entry level and at least 1 additional for the advanced. Standard 11 is student recruitment, acceptance, enrollment, and representation. Things you have to really provide to the student when you're recruiting them, things that have to be on public-facing materials, pass rate on national exams, things that they have to pass, English and math type of screenings, a variety of other things. Acceptance, what you need to be accepted, the enrollment and representation, faculty instructors, what the faculty, what they have to be a faculty member, the program director, documentation, different things with documentation for the students and for the faculty. Standard, slide 11, section 3, assessment of standards and key elements, assessment of the competency expectations, student learning assessments, how you assess them in the lab, tests from a didactic standpoint, how you assess them on externship, program assessments, program completion, performance on the exams, program satisfaction, including student, graduate, and employer, job placement, and assessment data on a CQI standpoint. So we really want to see what the outcomes are. So this is a full circle as well. We want to make sure that the program is really fulfilling the students' needs. And standard 15 assessment of the structure and process, and that's the ongoing assessment of the structure and process. And this, when you see the key elements, the breakdown of the key elements that we're assessing. Slide 12. So in taking that all into account, and again, if I had more time, I would go into the fees and how often we review and what happens when we apply. Maybe I can do that for you at another time. But I thought you'd be interested in states who have required completion of an ASHP ACP accredited program for technicians. North Dakota has required this for a very long time. I believe probably because they've had, you know, for the rural environment of the state, and they've had remote pharmacists and pharmacy technicians working remotely with telepharmacy for such a long time. Ohio has a little bit of a mix. Some pharmacy technician environments are exempt, but all technician training programs that are in community colleges, health systems, et cetera, have to go through an ASHP, ACP, must be ASHP, ACPE accredited. Nevada, the schools are required to be accredited. Louisiana. In South Carolina, they have a specific designation, a South Carolina certified technician, and they are required to go through an ASHP, ACPE accredited program. And that is in regard to ratios. I believe the ratio is 4-to-1. If you have South Carolina certified technicians, you can have a higher ratio of technician to pharmacist. In Utah, their regulations are in discussion, but right now they do have that one of the areas is to go through an ASHP ACPE accredited program is one of the recognized criteria. In Virginia, as of July 1st, 2022, all technicians must go through an ASHP ACPE accredited program where it has to be in candidate status. That means they've applied for accreditation, they're in process of being reviewed. And this is a busy area for me right now. I mentioned high schools. I'm working with all of the 18 districts that have pharmacy technician training programs in their high schools and working with them to get accredited. We have a few health systems that are in process right now and supermarket chains as well. So busy, a lot of footwork in Virginia right now. In Illinois, they were going to go towards mandating the accreditation in January 1st, 2022, but they've moved to 2024 due to COVID. So COVID has moved things back a bit. So this is sort of a Reader's Digest condensed version presentation on accreditation, but again, I'd be happy to answer questions for you. On slide 13, I have the contact information for our division and my personal information within ASHP if you'd like to email me at any time, and our website. If you go to www.ashp.org, on the top bar, we have a variety of things to look at, but when you go to professional development, or you can drop down on the very bottom on that, there's technician membership and accreditation, and if you hit that, the bottom square on the left-hand corner is technician accreditation. If you open that, there's a wealth of information about accreditation. But again, thank you for having me, and I'll be happy to entertain any questions. Thank you.
Thank you, Ms. Lifshin. Appreciate your presentation. Before we go into questions, I kind of want to also just kind of lay the groundwork of what is currently the relevant law in California for licensure of a technician. It does include various pathways, and those are associate's degree in pharmacy technology, completion of a training course specified by the board, graduate from a school of pharmacy, or pharmacy technician certification. And this is under Business and Professions Code, Section 4202, if you just want to reference it. And then also in the California Code of Regulation under Section 1793.6, we established the provisions for a course of training specified by the board, and that would be a completion of a training program accredited by American Society of Health System Pharmacists, a pharmacy training program provided by a branch of the Federal Armed Services, or any course that provides a training program of at least 240 hours of instruction covering specific areas. So that's just as background. That's our relevant law that's currently in effect. So now, kind of going to our three presentations around both accrediting a training program and then various certification opportunities. I appreciate the three presentations, and honestly, at this point in time, I thought they were pretty complete. I don't have any follow-up questions. Song?
No questions, and thank you to all the presenters for coming to us and giving great presentation. Thank you.
Jason, do you have any follow-up questions?
No questions at this time, Committee Chair.
Thank you. Jude, what about you? Do you have any questions?
Yeah, I have a question for Dr. Burke. Dr. Burke, you mentioned on your presentation that California has only 3% certified pharmacy technician. Did I hear that correctly, or?
Yeah.
About 30% is our estimation.
30%, not 3%.
Correct. Yeah, and that's based on, there's a couple sources of data we use there. One is the NABP Survey of Pharmacy Law, which has an estimate of the number of technicians in the state. I think we actually did inquire with the board at one point about the number of pharmacy technicians. And then we also look at BLS data, and then of course compare that to our own number. Plus you have to factor in the number of NHA certified technicians as well. So it's a rough estimate.
Okay. And these are active or just one-time certified? Because I know that a lot of them don't recertify.
So that is
certified once?
This is currently active. So those who have an active certification, I can tell you that generally our retention, the percentage of people that renew their certification every 2 years, hovers around 80%. I don't have that data specific to California, but I could likely get that if that's something you're interested in.
That'd be great. Thank you.
Yeah, just clarification. We, we have 4 routes, and only one of them is the technician certification, and we don't require you, once you apply and you get your technician certificate, your technician registration, we don't require you retain it.
Gotcha. Okay.
Cheryl, do you have any questions?
No, everyone answered pretty much all of my questions. Thank you.
Okay, thank you. Okay, let me open it up to anybody present here on Market Street at our site. Is there any comments from the public?
Hi, Shane DeSalle, Touro University, California. I'll just add a comment that there's a considerable amount of research that shows the value of certification. Those who are certified are have greater commitment to the profession, or more likely to engage in emerging activities, some of the things that we've already talked about, and as well as less turnover if they're certified. And I'll just also add real quick, and that's for both PTCB and NHA, because we've done research on both. And I'll just add, Jessica spoke on a couple of products about NHA. We actually used their math product even at Touro Pharmacy School as sort of a boot camp for the pharmacy students, and it was actually very helpful. It actually assisted them in class. So it's designed for technicians, but we're actually using that and a motivational interviewing tool of theirs in pharmacy schools right now.
So you said being certified, has benefits compared to no certification, or one of the other routes that we...
Compared to no certification.
Okay.
Yeah.
So you did not look at it compared to, for instance, having an associate's degree?
No, that was
Okay.
it was it was certification versus no certification.
Okay, thank you. Is there any other public comment here on Market Street? Okay, seeing none, moderator, would you please see if we have any interest in our WebEx community?
Absolutely. Our Q&A panel is open. And as a reminder, if you'd like to comment, please click on that Q&A icon and send the word text or send the word comment. For our calling users, you may dial *3 to raise your hand. Our first comment comes from Don Rodriguez. Don, I've sent the request to unmute your microphone.
Yes. Good afternoon, everyone, and thank you for taking my question. This question may be more for a Board of Pharmacy, but it does involve ASHP as well. And thank you for going over the possible pathways for technician licensure in California. As a person who may be potentially starting an employer-based ASHP, ACP technician program in California, I do have a question about, can employer-based pharmacy technician programs that are ASHP accredited utilize their students or technician trainees to complete practical hands-on and experimental training as part of their training program?
Yes, you can actually do that as you sequence it. You can do the didactic and then have the lab as an aside while they're learning in a different area, and then count their hours after they do the didactic and the lab. Does that make sense? While they're working, they can be working, but then you just count the hours as they're working later, and then assess the goals and objectives for that area of externship.
Yes, that makes sense. Thank you.
Yeah, different health systems have different ways of conducting their programs. Some health systems train the individuals they already have on staff. Some utilize it as a way to recruit people within the organization already. Some recruit people on the outside. But please feel free to contact me. I can walk you through it too. So
I appreciate that. Thank you. Yeah. Thank you, Lisa. I appreciate it.
Thank you.
Our next comment comes from Sarah Miles. Sarah, I've sent the request to unmute your microphone.
Hi there, this is Sarah Miles again from UFCW Western States Council. I wanted to add our comment to again caution the board in terms of creating additional certifications that can become requirements. We already all know that the barriers to entry are significant for pharmacy technicians, and an advanced credential could create some serious rent seeking and career caps for existing workers. I think of myself in perhaps that role. Middle-aged woman with 2 school-aged kids. If I needed to achieve a different credential to potentially receive a raise, often not very small, I wouldn't be able to do that with my resources, both in terms of funds and time. And that's something that we should really consider for our workforce in California who are already doing this job. So that's a major issue that we're hearing from our members. Thank you.
Sarah, I have a question for you then. Are your members feeling like the current pathway, the current 4 options are sufficient?
I think it's more complicated than that, and I think we need more information before I could speak to that.
Okay.
Thank you, though. Thank you for inquiring.
And with that, I do not see any other requests at this time.
Okay. Okay, let's go ahead and take a half an hour break. It's let's go until 1:15. So we will take recess for lunch now until 1:15.